Hello, and welcome to When Life Gets Tough, a podcast that tackles timely and relevant mental health topics in an easy-to-understand way for all. I'm your host, Katie Curtis. Today we have special guest and Foundation 2 board member Bryan Mullen with us to talk about Pride Month, healthcare in the LGBTQIA+ population, and what we can all do to best support members of the LGBTQIA+ population. We're so glad you're here, Bryan.
Thanks for having me on the program today, Katie. My name is Bryan Mullen, and my pronouns are he, him, and his. I'm really grateful to be here to talk about especially healthcare in the LGBTQIA+ community, as well as just our broad community here in Cedar Rapids, and how we support our community the best.
I'm so grateful for your expertise and professional background in healthcare. Having providers for LGBTQIA individuals who also identify as LGBTQIA+, or at a minimum can be allies for those people, is so critical for everyone to access the right kind of healthcare. Research shows that discrimination prevents members of the LGBTQIA+ population from accessing regular healthcare. What are some things that you see providers doing right, and how can others improve?
I think healthcare communities are continuing to evolve and continuing to educate ourselves and our staff on LGBTQIA+ topics. I think basically starting every conversation with every patient by identifying yourself with your pronouns is incredibly inclusive. So when I go to the bedside of a patient, I say, hey, my name is Bryan. I'm going to be your nurse. My pronouns are he, him, and his. Clearly, we're going to hit some patients who are surprised by that introduction and don't understand why we're doing it. But I think it's important for the patients that it does make an impact in, because they know then they have a safe person to talk to. They can be themselves freely. They can be free to tell you their pronouns and their preferred name, so that we aren't in that awkward position of calling a patient something that they don't want to be called. I think healthcare is continuing to work to make sure we are inclusive, but there's battles we face every day on how do we roll that out to everybody? How do we make sure our staff are comfortable and inclusive? How do we make sure our documentation system serves patients in the best way possible, so that every time they come to the hospital, they're not having to redisclose my preferred name is this, or my preferred gender identity is this.
Yeah, thank you for sharing that. And what I love about sharing your pronouns, it avoids asking a question, maybe if you're working with a youth or somebody who's not ready to talk about that. But like you said, they know now I'm in a safe place. I'm in a place where if I decide I'm ready to talk about this, I have somebody who I feel like is going to be supportive and will listen to what I'm saying.
Absolutely. And I think it's normal for everyone to screw up when they're new at this, but screwing up is fine, right? Recognizing that, nope, I messed that up. I'm so sorry. Your pronouns are they, and I said he or she. Just pick back up, apologize, move on. You don't need to dwell on it for longer periods of time. Admit that you make a mistake. Everybody does. Most people will be glad that you're at least acknowledging this and welcoming them as a person and who they are.
Yeah, that's kind of the same feedback we give to people who are having hard conversations about mental health or about suicide is, hey, it might be awkward. Hey, it might be uncomfortable. Hey, you might make a mistake, but you just, to your point, say, I'm really sorry. I misspoke, or I want to try that again and go back in. Don't dwell on it. So I find that interesting that we're giving the exact same advice for those two pertaining situations. And what do you think providers can do to make their facility LGBTQIA+ friendly?
I think healthcare systems are moving in the right direction by identifying which providers are the most comfortable and most knowledgeable serving the LGBTQIA+ population. I know both corporations that are here in Cedar Rapids have providers that not only specialize, but are learning more about these topics and learning how we as healthcare systems can better serve our communities. So I think all of the systems around the area have that option. And if you call the facilities and ask them, how do we find these providers, they will direct you in the right direction.
Great. And we will drop a link in the bottom of the podcast that shares how to find a doc for somebody who might be in the, looking for a new provider or a provider who is LGBTQIA+ friendly for them. So you can check it out down below. And I'm curious, are there questions that individuals can ask to see if a provider is a good fit for them?
I think being upfront and asking the hard questions of, hey, do you support the LGBTQIA plus population? I'm here to, discuss issues that involve hormone replacement, all of the topics that may be sensitive to some people. If you're upfront and ask those questions, you may get a wealth of answers, but it's better to know from the start and develop a good relationship. Or if it's not a good relationship, that's perfectly fine. You have to find the best fit for yourself to make sure that you are comfortable going to your provider with topics that can be sensitive and that maybe you're nervous about bringing up.
Great. Thank you so much for sharing that. So another timely topic pertaining to healthcare in the LGBTQIA plus population is blood donation. So men who have sex with men currently are required to have a period of abstinence prior to donating any kind of blood product. How is this perceived among the LGBTQIA plus population?
I can speak personally to that. Since high school, after coming out, I was honest at a blood donation. I'm O negative, so I'm sought after by
No kidding, yeah.
these organizations to donate blood. I'm a nurse. I work in healthcare. I know there's a definite need for blood to be donated, but for years, we've been told we can't donate. Restrictions have lifted some, but they're still far from where they need to be. All blood that's donated is tested. Everybody brings risk factors when donating blood of viruses, diseases, etc., that they may not even be aware of. So the safeguards are in place to make sure that patients needing blood transfusions get safe blood. So I think it's another stigma on a marginalized population that just continues to be present. And personally, I'm not sure that there's data that's significant to support that.
Yeah, and if you are interested in advocating for better laws and rights for individuals to donate blood, we again have some more information dropped in the link below. There's a number of Pride events. Cedar Rapids is such a great community to support the LGBTQIA plus population. So there's some events yet this month, and I think even into July. Can you tell us a little bit about what's going on?
Yes, the Pride events in Cedar Rapids this year have really taken off. One of the exciting things about having a Pride event that's growing in Cedar Rapids is that it can be an opportunity for folks who are questioning their orientation or who are nervous about coming out to come to an event and really have the support of others that are like them and supportive of the community, allies, etc. Having a safe space to come and meet people, to network, to know that you are safe, you are great the way you are, and that there are resources for you if you're struggling. It's a place that you can come, be yourself, and maybe take some tools away on how to come out or how to deal with some of the struggles that you're facing. Pride plus Foundation 2 and all the offerings here really provide a good support system for anybody who's struggling with crisis. But I really appreciate that Foundation 2 has a strong support for the LGBTQIA plus community and wants to make sure that everybody stays safe and continues to thrive. There's been a lot of growing in Pride over the last 6 years since I've come to town, starting with basics, doing a lot of the support for Pride events, and it's just grown and grown. This year we've already had our first Pride parade, and that was a great time had by a lot of people. Upcoming events, Pride Fest is going to happen on July 9th. There's a silent disco, there's drag queen performances, and there's events to follow at Basics, the gay bar in town. So if you are interested in those, the website to see more information and all those details is crprideia.com.
Thanks again for coming today. We're so grateful to have you here, Bryan. Your expertise, advocacy, and support as a board member to Foundation 2 Crisis Services is so pivotal. I appreciated the opportunity to learn a little bit about your story, and I know it provided some comfort and strength to other people who are listening. Thank you guys all for joining us. As always, if you or someone who you know needs mental health support, the Foundation 2 Crisis Services Crisis line is available 24/7, 365 days a year. All of our services are free and confidential. You can access the line at 319-362-2174. Thank you for listening to When Life Gets Tough, and we hope you'll join us next time.